Welcome to Mock Interview Pro. If you're preparing for a role as a recovery room nurse, you're in the right place. Today, we're diving into some insightful interview questions that will help you shine in your upcoming interview. Let's get started with our first question. Can you tell us about a time when you identified a potential safety issue with a patient in the recovery room? What actions did you take to address it? This question is designed to assess your attention to detail and your ability to manage patient safety issues effectively. Here are some key points to consider when formulating your answer. Describe the specific safety issue you noticed. Explain how you quickly assessed the situation. Detail the actions you took to prevent harm, including teamwork if relevant. Share the outcome to highlight the effectiveness of your response. Let's look at an example to illustrate this.
While monitoring a patient in recovery, I noticed their oxygen saturation dropped below 90%. I quickly checked their airway and found that the oxygen mask was not properly positioned. I immediately repositioned the mask and called for additional help. Working together with my team, we secured the airway, and the patient's oxygen levels improved significantly.
By the way, we're only covering a handful of questions in this video, but I've prepared a free PDF with all 30 top interview questions for recovery room nurse. It also includes example answers and tips to help you prepare with confidence. The download link is just below. Could you share an experience where you collaborated with surgical teams in the recovery room to ensure patient safety and comfort? This question helps evaluate your teamwork skills and how well you communicate with other healthcare professionals. Here are some tips to help you craft your response. Start by describing a specific situation you encountered. Include the roles of the surgical team members involved. Explain your actions to foster collaboration and communication. Highlight the positive outcomes for patient safety and comfort. Conclude with what you learned from the experience. To give you an idea, here's an example of the same answer.
In a recent case, I worked with the anesthesiologist and surgical team during post-operative recovery. I noticed the patient was experiencing discomfort, so I promptly communicated this to the surgeon. The surgeon adjusted the pain management plan, and our teamwork ensured the patient was stable and comfortable. This experience reinforced the importance of effective communication in patient care.
Describe a time when you had to prioritize multiple tasks in the recovery room. How did you manage to maintain high-quality patient care? This question assesses your organizational skills and ability to prioritize effectively under pressure. Consider these points when structuring your response. Identify a specific situation with multiple tasks and limited time. Explain how you assess the urgency and importance of each task. Discuss the tools or methods you used to stay organized. Highlight the outcomes for both patients and overall workflow. Mention how you communicated with your team during this process. Here's an example to illustrate how you might answer this.
During a busy shift, I faced a situation where one patient was experiencing a sudden drop in blood pressure, while I had another patient just out of anesthesia. I prioritized the first patient and delegated the monitoring of the second to a nurse's aide. This teamwork helped us maintain high-quality care in the recovery room.
How would you handle a situation where a patient is extremely anxious after waking up from anesthesia? This question evaluates your interpersonal skills and ability to provide emotional support to patients. Here are some strategies you might include in your answer. Assess the patient's level of anxiety and any contributing factors. Use a calm and reassuring tone to communicate. Provide clear information about the recovery process. Use techniques to distract or comfort the patient, like guided breathing. Involve family members if it's appropriate. Let's look at an example approach to this situation.
I would start by assessing why the patient is anxious, whether it's due to confusion or pain. Speaking calmly, I would explain their current situation and the recovery process. I might also suggest deep breathing exercises to help them relax, ensuring they feel safe and comfortable.
If a patient isn't recovering as expected and shows signs of distress, what steps do you take immediately? This question examines your ability to respond swiftly and effectively in emergency situations. Here's how you might structure your response. Quickly assess the patient's vital signs and overall condition. Notify the supervising nurse or physician about the changes. Administer necessary interventions according to protocol. Reassure the patient to help reduce anxiety. Document observations and actions taken in the patient's record. Here's an example of how you could respond.
First, I would check the patient's vital signs to assess the situation. I'd inform the supervising nurse immediately about the distress. Following protocol, I might administer oxygen or medications. Throughout, I'd reassure the patient that help is on the way and document everything thoroughly.
Before we wrap up, remember you can get all 30 questions, example answers, and step-by-step tips in a handy PDF. Totally free, just grab it below.